Hi there and welcome back. Let's continue today with Beals syndrome. We'll get into the characteristics or the signs and symptoms, causes, compare and contrast the Marfan syndrome, statistics, diagnosis, treatment, and the underwriting. Beals syndrome is a disorder of connective tissue. The syndrome was first established by Beals and Hedge in 1971. Features of Beals syndrome are found throughout the body, especially in large joints. Beals syndrome is also referred to as congenital arachnodactyly. The vast majority of people with Beals syndrome have isolated features in the musculoskeletal system that often improve with age. Characteristics: long, slender fingers and toes, curved spine, long, narrow body type, backward or lateral curved spine at birth or early childhood, facial abnormalities, usually small jaws, high arched palate, chest sinks in or sticks out, crumpled appearance to the top of the ear, reduced bone mass, aortic enlargement, and or mitral valve regurgitation occasionally are the typical characteristics of the Beals syndrome. Causes: Beals syndrome is caused by a mutation in a gene that helps build connective tissue called fibrillin 2. It is closely related to gene fibrillin 1 that causes Marfan syndrome. So that answers one of the things that we wanted to cover here about the Beals and the Marfan syndrome. But let's continue further. People with Beals syndrome have many of the skeletal or the bone and aortic enlargement problems as people with Marfan syndrome, and treatments for these problems are the same. One difference from Marfan syndrome is that in Beals syndrome the eyes are not affected. Another major difference in the way in which Beals syndrome affects the body's joints. People with Beals syndrome are unable to fully extend joints like their fingers, elbows, knees, toes, and hips. Their joints remain bent and deformed. When joints remain contracted for long periods of time, the muscles can become tight and short, restricting movement. When contractures are present at birth or say congenital, they can delay motor development. Enough on the Beals and Marfan syndrome. Let's move on to the statistics. While there is no info on the exact prevalence of Beals syndrome, it is estimated that the incidence or the number of new cases within a given time of Beals syndrome is less than 1 in 10,000 people per year. Beals syndrome affects males and females of all ethnicities in all parts of the world equally. People with Beals syndrome have a 50% chance of passing the mutation on each time they have a child. How do we diagnose? It is based on the presence of a group of specific symptoms: long, thin limbs, narrow head and body, abnormal bending of the spine that causes a bowing of the back, permanent bending of multiple joints that restrict movement of the elbows, knees, hips and fingers, abnormalities of the ear such as crumpled ears, underdeveloped muscles, permanently bent fingers, and toes that cannot completely straighten, long, slender fingers and toes, protruding chest bone, ectopia lentis, or lens dislocation, aortic dilation, MVP and regurg. So those are the typical. Genetic testing for FBN2 is available. When there is a known disease causing gene mutation in the family, prenatal testing is available for pregnancies that are at the risk for passing the FBN2 gene mutation onto their child. Genetic counseling is also available. Genetic counseling can be helpful in family planning, determining genetic risk, and discussing the availability of prenatal testing. Treatment. The treatment is different for each person because treatment is dependent on the features. It is important that anyone diagnosed with Beals syndrome has a team of doctors to help monitor the syndrome. These doctors can include pediatricians, surgeons, cardio, ortho, ophthalmologists, and other healthcare professionals. People with Beals syndrome benefit from physical therapy that can improve mobility of joints and strengthen the muscles. Surgical procedures may be necessary to release joints and other parts of the body that are in a permanently bent position. Sometimes braces and surgical correction are used to provide stability when kyphoscoliosis or scoliosis is present. People with Beals syndrome should have their heart monitored to check for cardiovascular complications that may arise. So, how do we underwrite? As far as underwriting goes, follow your underwriting manual and the company specifics to do the risk assessment and the final underwriting. Let's take a break here. See you soon. Take care. Bye now.